Dr. Dawood also directs the activities of 6 health promotion coalitions formed to address major chronic disease in Fulton County, Georgia. Under her leadership, the Fulton County Chronic Disease Collaborative Partnerships have grown to over 400 businesses, organizations, and individuals. Prior to this position, Dr. Dawood worked as a clinical researcher at Emory University. She served on the President's Commission on Race and Ethnicity and was recognized as We Are Emory 100 Community Builders. Dr. Dawood currently serves as a board member in the South Asian Public Health Association and Georgia Alliance for Health Literacy. With that, let us welcome Dr. Nazeera and ask her to start her presentation. Dr. Dawood, the floor is yours.
Thank you so much. Can you hear me?
Loud and clear.
Can you hear me? Okay, great. Good morning, everybody. It's 6 a.m. here in Georgia, USA, and I'd like to say good afternoon, good evening, and not yet good night because I'd like you to go to sleep after my presentation. Thank you so much to Mustafa and the IOMC team for inviting me and allowing me to participate and talking about my passion, which is humanity, and how do I integrate humanity in the everyday work that I do, that is being a public health professional. Let me figure this out. So overview of my presentation today is understanding humanity. It's very simple but yet complicated. And of course, if any of you are in public health or you are a physician who's taken up a public health career, what is public health and how do you integrate humanity into your public health practice? And I'm going to give you some personal insights because what's not better than telling your own story? Which is a true story. And then finally, I'm going to leave it up to you on what you can do. I'm not going to tell you what you can do, but I'm just going to give you the tools to see how you can integrate my personal insights that I've given you into your everyday work or practice. This question, just take a few seconds and tell me who are you. If someone comes and asks you, who are you? If any of you can chat in the answer, that'll be great. And I want to give some insights on that. So if someone asks you, who are you? What would you say? Mustafa, you can answer too. Okay. As someone said, I'm a global citizen. I like that. Okay. So what I did yesterday, I randomly asked a few people the same question. Just out of the blue, I asked them, who are you? And these are some answers that I got. They said they identified themselves as race. They said, I'm poor, or I'm a woman, I'm a black, I'm a man. They said I'm a businessman, I'm rich, I'm a teacher, I'm a politician, I'm homeless, I'm a scientist, I'm a doctor, and I'm an Asian, right? Look at you universally. What is common among all of us universally, right? And I also asked a 6-year-old, who are you? And the first response that she gave me was, I am a person. And I was really intrigued by that because here I asked a variety of adults, who are you? And everybody recognized themselves according to their gender or their achievements professionally or the materials that they had in this world or through their race. And here's a 6-year-old who said, I'm a person. So the answer I was looking for really was, who would say the real thing that they are? How would we identify ourselves universally? So if an alien came into Earth and asked, who are you? They wouldn't identify us otherwise. But if we said we are humans, we've shown a common thread among all of us, right? Okay. So the next slide, humanity, like I said, it's very simple, but yet very complicated. I looked at this some depth. It was very hard for me to define humanity. it's hard because when you go and look into it, definitions, it's hard. But I tried to pull the main juice of what you needed to define humanity. It is about the quality or state of being human. So when we say humanity, just us being a human is humanity, right? And then when I started further researching what is humanity, it started saying the capacity for feeling for others' unhappiness or misfortune. And just imagine, and I want you to think about, when I'm talking, I want you to think and put your personal self into this when I'm talking about this. Do you have, or do we have the capacity for feeling another's unhappiness or misfortune, right? Another way of defining humanity is an ethic of kindness, benevolence, and sympathy extended universally. It's not just to our families and friends, but anywhere we go, are we able to express this ethics of humanity and being impartial to all human beings, right? The three strengths that are defined as love, kindness, and social intelligence. I'm like, okay, wow, I like that. So what is social intelligence? It's an ability to understand and manage men and women, boys and girls, to act wisely in human relations. And that really intrigued me as I started reading further into these definitions because I said, okay, how do I know if humanity still exists? Because then we would really not be seeing so much sufferings and the inequities and the disparities around us, right? Because we would have felt the capacity and we would have taken some actions to move it into a positive direction. So the biggest challenge of our times, of all times in the current era, can any of you guess? Just like I said, it has to be universal, it has to be impartial, and this is my opinion. I think that the biggest challenge of all times in the current era is the social intelligence. As I said, what was social intelligence? In the previous slide, we sort of said that it's our capacity to feel for another's unhappiness or misfortune, right? Because if we did have the capacity and we did have the tools to feel for them, we wouldn't see what we see in these pictures, because we would have helped and taken action to everyday sufferings that we see, either as public health professionals or doctors or even as a common citizen, right? Okay, and we could have, this is I'm usually very ambitious, so I say I believe we can eliminate poverty. I believe we can eliminate homelessness, right? Okay, next slide. You have to find your motivation, no matter who, whether just for your career, for your family, or yourself, you have to find your motivation. When I saw this picture, almost, I know I didn't get to see it in '94, but when I got to see it around in 2000 sometime, this was my motivation. It affected me so deep, as if an arrow piercing my heart, that I never let it go. I just can't let this picture go away from my mind. And I'm sure this was a very famous picture. It got a Pulitzer Award, and the guy who took it describes it as this vulture, this bird waiting for this kid to die so that he can feed on the kid's flesh. I mean, even now it's very touching to me because it's a human being. This kid is a human being, right? And we've let it go so bad that we wait. It's the reality. Sometimes we have to take the sugar coat out, and we have to look into reality. So this is my driving force. I don't want to see this happen. It is so bad for the photographer who took this picture that looks like he committed suicide 3 months after he took this picture and published it. So who decides whose life is more worth, right? Who decides that? What is the worth of the child born in the U.S. versus a child born in Sudan, or a child born in East or Mid-East or Asia or anywhere? They're human beings. So who decides on the worth? So is it okay for a child to die in U.S. and it's not okay to die somewhere else? And these are just thought-provoking questions. I'm putting it out there. I don't have the answers, but at least I know there are some steps that I can take on my own, like how I can empower people about the possibilities, right? And in the search for a world where we can have the highest standards of physical, mental, and social well-being, the dignity, the autonomy, and progress of every human being. Doesn't that look like a perfect world where everybody has the dignity of living, being a human, and they have the autonomy to make decisions and progress for every human being, and the broad goals of health and human rights are universal and they are eternal, right? They give us direction for understanding humanity and also the tools that we can use in our daily work. So find your motivation. What is it that will drive you every day? Public health. Of course, we all do public health in some way or the other. Why? Because we breathe public health, we eat public health, we are drinking public health, and we are staying safe because of public health. What do I mean by that? 30 years ago, people didn't talk about smoking, and now tobacco and secondhand smoke is in its highest awareness. Smallpox was eradicated. We have safe and healthy drinking water because of good fluoridation of water and also safety, health safety. We're eating safe food because of environmental health. That's in public health, which makes sure that the food is served with safe standards, right? Okay. Going into core functions of public health. Of course, assurance, assessment, and policy development are the three core areas, but the main 10 functions are within this circle, right? And if you look at it, I would say more than 50% of the core functions is community engagement and community involvement, because we look at the policy development part: inform, educate, and empower, mobilize community partnerships, develop policies, and then you also see on the blue circles, link and provide care. This is all touching directly with the community members. So I would say more than 50% of the public health requires community's involvement. So when you do that, you have to make sure you are really, really getting their engagement into this process of public health. Of course, prevention makes sense. That's the core theme of public health, because you're preventing a person from complications from diabetes, heart disease, and you're treating people in a group, in a community public health model versus one person, like a doctor treating one-on-one. So public health takes that sort of one-on-one approach and puts it into the entire public health model, right? Okay, and next slide. This is, again, I've presented this slide before, but public health is everywhere. It's at work everywhere, right? And we, as public health leaders, must continue to face the changes or the challenges of the new millennium, which is nothing but connecting the dots. How many of you know that these dots are not connected? These links have not been met. We've not connected, because if we did, or if we had done it in a very effective, positive way, we might not be seeing many of the challenges that we see at this time. So our job is to, have we connected these links? Have we started the dialogues? Have we invited them to look at how we can connect these dots and complete the circle, right? and try to put a face on all of these dots. Imagine if you saw a face and said, hey, this police is supposed to be working with the schools or the community centers and the health department to improve the health of this community, right? And you must be wondering, okay, wait, humanity and public health, what does that make sense? And I want to give you, the next few slides are going to be exactly saying why humanity should be integrated into public health. Look at this picture. What do you see? I mean, don't you see a possibility that this environment can be changed into this environment? And why so that the tree on the right side is much greener than the tree on the left side? So anything that starts from root, you know, it all starts from the root. Is it watered well? Is it in the right environment to flourish? And every time I show a picture, I want you to put a face to it. Take a child that you might see in a unhealthy environment. I don't want to call it slum, but in an unhealthy environment versus a child growing in a good, healthy environment. So where was the root cause? What happened? So sometimes just putting band-aids to challenges is going to create a bigger challenge at a later time. So instead of just putting band-aids, why can't we look at the root cause and say we can change this environment? Because public health is about making the healthy choice an easy choice, right? Why can't the child have easy access to the same greenery that the child on the left might not? So why can't this tree could have had more tools available, just like on the right side, right? So of course inequities matter, but then also what can we do ourselves to make that happen, right? And deriving knowledge from personal insight, I believe really in telling stories, because if you tell me a story, that's what I know who you are. I know the experiences you've faced, and I know the lessons you've learned. So I want to give you some 3 real-time examples from different parts of the world that personally I've gone through, and what are the things that I've derived from such examples. And I say examples, real-time stories. And tell a story. I always like telling a story, because when you tell a story, you get very excited, because that happened with you. You don't have to put extra words or sugarcoat, but you just tell it as it is. So I want to hear what your story is. People want to hear what your story is, and why are you here, and what is motivating you, right? Okay. The next picture is, I want to introduce you to my 3 friends on the left, and of course the governor of Georgia on the right. So if I asked you, whom would you take a picture with, right? And this was a random question that we take to everybody around us, and we ask, whom would you take a picture with, right? Walter Jerome and Bo Peep are good friends. They are sometimes homeless. They are still struggling to be recognized. They have their own challenges. So let me put it that way. They have their challenges, and so I don't know what the answer was if I asked you whom would you take a picture with, but I want to say equity and respect. What if Walter Jerome and Bo Peep were given the same respect as the governor of Georgia, right? And the governor of Georgia has access to everything. He has friends around him. He has the right environment to flourish. But why don't Walter and Jerome and Bo Peep have the same respect that they deserve as human beings, right? So this is just thought-provoking questions that I've encountered. They were living just right to our health department, and traditionally they've not been reached out because they were considered as the dangerous part of the city. But you need but I didn't consider that because I consider them as human beings, and I said, let's go shake hands and smile and start a conversation. And because of that, we were able to build trust. We were able to show them that we are approaching them as what do they need rather than what they can do for us. So that really opened up several doors and opportunities. They came into the health department. It was just 10 steps. They have traditionally been left out of the system, but all it took was a genuine handshake and a smile and an invitation to help them, and which they very well accepted. In the next few slides, I want to talk about my inspiration. Why am I very passionate, and why am I inspired to do the things that I try to do and empower the community residents, especially those who don't have a voice. And sometimes I do say sometimes because they're suppressed or oppressed. So find your purpose. I'm sure you have a purpose. You are a doctor, you are a public health professional, you are a community health worker, you are an activist, you are a politician, but find your purpose more than that, not just because your job requires you to do that, but go beyond that mile to get it done, and find joy in the small things that you don't notice every day, right? I'm going to talk about my 3 inspirations that has really helped me be where I am today, right? Inspiration number 1 is Bobby. I met Bobby 3 years ago when I joined the health department. He would be sitting there in his place every day along with friends, and when you look at him, what do you see? I mean, you know, when a normal, common person who's surrounding him in the other buildings and are working in the health department trying to protect and save the same people like Bobby, was never reached. He was never reached. He was left out of the system. So when people usually see him, what do they see, right? They see him as hopeless. They see him that he's in despair. He's in poor health, of course, missing teeth, heart disease. He's an alcoholic. He's pleading for help. He's hungry. He's, of course, a heavy tobacco user. He is depressed, and the worst of all, he is excluded from the system, right? But what is the reality when you go talk to him and you hear his story? What is the reality? He is an Army veteran. He fought in the wars so people in the U.S. can be safe. And he's a war hero. He's a compassionate friend. I've never felt so much compassion than anybody else I've talked to. He cares. He asks, hey, have you eaten breakfast? Have you eaten lunch? He cares. And if you walk in front of him and if you fall down, you trip and fall down, he'll run to come and help you, to lift you up. That's the friend I know in him. He's a community volunteer. He's very friendly. He's such a peacemaker, because when I see him around friends and when they start arguments, I see that he's bringing peace to them and bringing people together. He's rich with character and commitment. So can you see 2 different things with the same person, Bobby, who's my inspiration? When I started talking to him, all the things that I found out in the right is because I went and approached and talked to him, which otherwise I'd have never known. So sometimes we have to take the step that nobody wants to take. If we do want to make changes, we do want to be bold enough to take a step that's not a status quo, but something different, right? Okay, so what happened because we sent the invitation to Bobby and people and friends like him? We were able to start this community garden, which was right there, and bring the students, bring people from several sectors, gender, age, race, and build this. Before this, they were not invited for anything. All they were perceived is, how we were perceived was just as, oh, they're drinkers, oh, they're a dangerous part of the community, don't include them. But as we started including them, they became volunteers in our own project. And because of that, this project was able to come through to start this garden along with Bo Peep and Jerome and Walter and Hot Rod and Fudge, who were able to connect, and they worked so hard that day to make this happen, right? And coming together and finding shared goals, because they wanted a community garden, they wanted fresh fruits and vegetables. So how can we work this together along with that community and transform their communities? So things like this, when you involve the community deep within, you can transform communities. Just imagine the possibilities, but not just imagining, but taking the next step and making it happen. I've always believed that, I don't know, this is just a long time dream of mine, that we can, every time we hear about Mumbai, we hear about the slums, and we hear about this $10 million building that's just next to the slums. We hear about this person really disabled in the slum area, and then we hear about this Porsche car just like 10 feet next to that slum area. I've always imagined that we can transform that area if only people put their mind into it. And then sometimes they ask, no, it won't happen because it's the system. And then I ask, who is the system? You are the system. You make the system. So you have to go beyond and beyond the boundary and remove the limitations to make changes and transform communities like this. And that happens only if you invite people to dialogue and help them and show them the possibilities of what can happen, right? My inspiration number 2 is Brennan. Brennan Passens is a child who touched, again, like the arrow struck deep into my heart. She passed away in 2011, and she was 11 years old, and she died away because someone had not connected the dots and had not told her mom that because of complication from asthma, which could have been prevented. It could have been prevented, but the mom didn't know, even after 10 years of going to doctors' visits and pharmacists and everybody and friends, she didn't know. All she could have used was an epinephrine pen. Could have probably prevented the anaphylactic attack that Brennan had. And when her mom told me this, she called me once in my office phone, and we started talking, and she was very skeptical, she was very not happy about the answers. But then finally I asked her, why did you make the call? She said, because I had my child die in my arms. So when she said that, I called her right there next week. We sat, we talked, and we're good friends now, and she calls me Brennan's warrior. And it doesn't happen just like that. You have to invest in your clients. You have to invest in your community and show them genuinely that you are there because you care, and not it's beyond the job and the money that we try to make, right? And why else I connected with her? Because peacock was her favorite bird. And if you are from India, you know that peacock is our national bird. Of beauty and tranquility, and so I saw that all in her. She was a peacekeeper. She always questioned the system. She was always joyful. She spread peace, you know, and we had to lose her. And show the language of compassion and care. Here are two families completely from opposite sides of the spectrum, one from an affluent, well-to-do community, another one struggling with challenges to just live, to come up to a middle-class family. On the right, you see two pictures of one is of Kellen and another one Brennan. Kellen also died because of asthma, and because the policy at that time was the kids not use inhalers in schools without the presence of a nurse. So he went into a very bad asthmatic attack, and he couldn't use the inhaler because the nurse was not next to him, and he collapsed. He died right there in the bus. And of course he told the bus driver to tell his mommy that he loves him. So these stories really pierce deep into my heart, and so should into anybody's heart. Why should we be okay by losing these lives, right? So what I was able to do was bring these moms together who would have never connected otherwise because they're from opposite spectrum of life. And they found unity and commonality because they lost their children to asthma. So I was able to bring their story to other public health professionals across Georgia and build that bridge that let's make it about human beings rather than about race and color and money. This poster was designed by the two moms, and we take this poster on the right everywhere to all our summits when we want to talk about asthma prevention and increasing awareness. So that's my second inspiration, Brennan. My third inspiration is Dr. Kausalya Devi. She is also known as Amma in India. I used to work as a physician in India in a rural hospital, Kasturba Gandhigram Hospital in South India. And when I met with her, I watched her, I observed her. I was just starting practice, medical practice then, but when I started observing her, she was in her 70s, and how she would wake up every morning at 5, and would be there to treat patients. She would still conduct, she'd go into the operation theaters in the morning and conduct surgeries. She would touch each patient. And many of them would come to me and say, hey, she has some magical powers. It was, and they would say, she just needs to touch my tummy because then I'll have a normal delivery baby. She was an OBGYN. She is an OBGYN, still working hard, and but she put 200% into what she did because the people whom she employed in the hospital, where you could see that they had a story to tell. The employers were either they were victim of a domestic abuse, or they were widowers, they were disabled, but she was able to empower each of them and show their talents and bring joy to their lives that they had lost hope. So she brought hope where people had lost hope. The right is a very, on the right lower part of the picture is very, I keep that picture in my mind because these are babies who are left on the doorsteps because the parents didn't want their babies for various reasons. They couldn't raise the babies, or they were just not ready to have, but they had the baby and they don't want the baby. And the lady who's taking the child is a worker who works, is a nurse actually in that same hospital, and has been struggling to have a child for 10 years. And that couple had been struggling. So someone's trash can be someone's treasure. I want you to always know that nothing in this world, any human being, nobody can be trashed because they are always someone else's treasure. And how do you make that connection? I'm sorry, I become very emotional when I talk about this, but Dr. Devi is one such person who made that connection because she knew the value of being a human, value of human beings. So she said this baby could be this person's joy and treasure. And she brought so much, because can you see how she made that connection? And of course she's been ridiculed, she's been criticized, but she stood strong on what she believed in. She transformed so many lives, and like I said, all the employers working there she brought them hope. She empowered them to help others. And the upper picture that you see is the children's orphanage home that she also manages. And if you walk into that children's home, you would see such great bond in these children. I would go and celebrate my birthday there, and those are the birthday memories I've always kept so much. It's green, it's still green in my mind and my heart, they made a bouquet once for my birthday, and that was the best ever gift that I've ever received because they made it with their hands. And these kids don't have parents, you know, and they still struggle. But the love and the bond that they carry with each other, you can't even see it between real sisters and brothers. And so I'm sorry, but you know, it just brings back memories to me, just how joyful they are and how much happiness they spread. In that hospital, you know, in that hospital you go, and when I went in, I had already completed my Master's of Public Health, so I really wanted to implement a public health program in there. And the program that we took up was implementing a HIV prevention program. That means screening all antenatal mothers for HIV so that the kids, the babies, can be prevented from having this transmitted through their mom. And when I started talking about it, I got a huge pushback because nobody in that rural hospital area talks about HIV or AIDS or even sex in that matter, because it's a huge taboo. But because I believed in this program that could save lives, that could prevent future kids dying from HIV and AIDS, I stood strong. I was ridiculed. I was even called AIDS doctor. But that didn't bother me because our existence here in this world is sometimes for others rather than for ourselves. But because I stood strong, I was able to convince the 200 staff from all levels, from senior administration to the students, to the clinical community health workers, to nurses, to doctors, to the service providers, the cleaners and the sweepers, conducted a one-day training for each of these sectors and showed them exactly what this program could help us if we all came together. And I can never forget that there was this particular nurse who was completely against it, and after she went through that one-day training in the evening, she said, "Dr. Nazeera, you changed my heart. Now I feel exactly what a person with HIV feels, how left out they feel even though it's not their own fault." So just bringing the human aspect to all this, you have to be persistent. You cannot give up. You just cannot give up. And what legacy do you want to leave? You know, is it just your job, so you can just have your job and have your and have a family's needs met, or just take an extra step in making it happen, making a change happen that is meaningful, right? And now I'm not in that hospital. It's been 7-8 years since I'm out of that hospital, but the program goes on, and they still call it. They don't. Recently, someone called me and they said this Dr. Nazeera's program is still going on. It's not about Dr. Nazeera's program, but it's about the sustainability. What legacy did you leave when you left? Or was it just another job that you took up? So this program has really, even when I was there, we were able to identify 20, 50 cases of HIV positive patients whom we conducted the C-section on, and we were able to give the dose of nevirapine to the babies born right there. And the first C-section, many of them, when they found out the patient was HIV positive, didn't want to touch the patient. So you have to take the courage to do it. After the C-section, the mom and dad, for the first person ever, we conducted the C-section after knowing the mom was HIV positive. They came to me after 3 months and they said I had to name the baby. And that was again a big memory for me. Like, why would you want me to name your baby? Because they said we've never felt this much love and this much belonging in a hospital. You took care of us so much. You didn't let my wife be separated out, but you gave her so much care and compassion and gave us a nice, good, healthy baby. So sometimes you have to take that extra step, especially to the people who are affected, right? you have to break barriers. If you're going to be in public health and if you are a leader, it doesn't mean every time you have to be a leader. You can be still you and break those barriers. What do all the religions teach? They all teach compassion and care. And sometimes the world peace is missing in this age and era because it becomes about the religion that is really not teaching, which is hatred. It becomes about it's my religion and you don't belong here. What if each of these had babies' faces? Each of these dots had faces of babies. Is that what we want to teach the babies when they're born, saying, no, you belong to this sector, you cannot talk to that sector? So how can you break those barriers and connect the links? And I want to give such an example of what we did. We were able to bring people and leaders from various sectors, from the Hindu community, Baha'i community, from the Christianity, Islam, Buddhist, and Jewish community to come and talk and start the dialogue. Like I said, you have to invite people to start the dialogue. You know, find the common ground. Yes, we all have a religion that we we stick to, but then where's the common ground? How can health, in the name of public health, bring world peace, right? And then we were able to introduce these leaders together and start that dialogue to talk to each other about the commonalities. We were also able to introduce the intercultural cuisine. So when all of them came to the Hindu Temple of Atlanta here in Atlanta, and when they saw the food that was served, they were all intrigued. They were very intrigued, and they said, wow, this is excellent. How do you prepare this? How do you prepare that? And when we went into the Baha'i community, and when their food was shared, and how there was no fried foods and healthy food, and we started exchanging recipes. How does this happen? So in the name of public health, in the name of health, I believe we can bring world peace. Like I said, because every human being's life is worth every dime, right? And then diversification and unification. I call this picture a picture of the century because if you know the history of U.S., there was this huge segregation, civil rights movement. So when I was able to bring these two people together and help them find the common ground, I feel this picture is so real. It's so real. Probably 60, 70 years ago, we might not have imagined, but right now they're looking right into their eyes, probably have gone through so much in their lives in the past, and you know, you can change status quo. It doesn't have to remain the same. Do you have to fight? Sometimes it does need a fight. Sometimes all it needs is ask a broader question and ask people, why is this happening like this? And be transparent about your activities and actions, and try to transform thinking. When you ask some questions to people, they say, well, that's how it has been always. Why that's how it has been always? Why can't you change? And show them that possibility, a picture of possibility. If we change this routine, we could achieve this. If we change this, and then show them a flow chart of where final results can be into a positive outcome, right? And make those connections, and don't make it about talk, because you have to show actions. Sometimes what it becomes is we're just talking, but then people recognize and realize you're doing things when you show changes, a before and an after picture, because you've acted, right? So start action. This is give a voice. If you are talking about healthy physical activity, healthy nutrition, give a voice from within the community. The lady in red with the hat is 92 years old. She was living in a community. I was able to go into her house, sit next to her, hold her hand and talk to her, and guess what are all the good positive life that she gave me? She said she eats oats every day. fresh fruits and vegetables, and she takes a walk. She walks for a mile every day. And this is the message I wanted to give to the community, that here's a 92-year-old lady who still believes in healthy living. She believes in eating healthy. She believes in physical activity, so she takes a walk every day. So that sort of, and the audience was public health professionals, and they were all awed. Wow, really? And here's a community member coming and teaching the professionals of why she stays healthy. And anything that you do, make sure you're accountable to the community or the people whom you are serving, right? And always there's a perception. Like when I talked about Bo Beep early, there was a perception, but when you went and broke that perception, the reality was he could be a very good friend, right? And to build trust, you have to show your genuine efforts. And especially when you're dealing with the community, when you say something, you have to follow through, because if you just say, they know you're just lip service. So you need to start following through, and you have to be available to them anytime, because community works 24 hours. So you cannot say, hey, sorry, it's my 8 to 5 job, I don't work anymore. But you should be able to allow them and open the door so that they can contact you even at 10 in the night if need be, which they don't usually, because they give respect to your time. But if it does, there's an emergency, they should be able to contact you for answers. And have the courage to take bold steps sometimes. I believe in this a lot. You have to uplift your youth and emerging professionals. Sometimes when I see 70 and 80-year-old people in the same leadership, in the same position for the last 40 years, I feel like that's not sustainable, because you should have passed the baton. You should have passed it on to a younger generation. And so I was able to bring in so many interns and fellows to this program, and they learned a lot. I mean, I feel good that they've gone back to their School of Public Health and talked and asked questions to their professors about, is this how the theory works? Because I was in the community and the theory was flipped over. So they are able, because you're able to show them this is where the rubber meets the road. You're able to show them the reality and open up their doors. And of course, have fun when you start building teams. You know, it should be a joy, even if it means going cuckoo. They've learned a lot, and they've had pleasure working. It was not like something forced on them, but you know, it was like learning experience with pleasure, right? Getting back to humanity in public health, how can you measure all this humanitarian efforts in public health? Well, you can't. How can you measure when you lift someone up, right? And public health needs evaluation, so that's something you might want to, everybody talks about evidence-based approach, evidence-based approach. Sometimes there is rights-based approach, right? And I'm going to finish in the next couple of slides, but I want you to think about this. Whose problem is this? Because you might be seeing it in your everyday work. And who is the system? Here's an industrial that's spilling out waste, and it's going into the right side of the community traditionally all the time, and is affecting the health of the people on the right side. The left side is an affluent community, very good in health, has no problems. So do we see this disparity and be quiet, or we start talking and talking about it and saying, why are these people on the right always affected? What is it about the people in the right? Why are they always oppressed and suppressed? How can we bring them equity in respect? How can we bring them equity in health, in every matter of being a human? How can we allow them to be a human being? Okay. And I looked at words that I used, common words in public health and humanity. These are the words that I saw mostly used in public health and separately in humanity. what if these two segments can be combined? Just imagine the addition of public health and humanity can bring justice, can bring equity, right? It's hard to evaluate. You don't have to go back always to the great leaders we've had. I'm sure you have your own inspirators right in front of you. They might not have credentials or titles, but they have inspired you in certain ways. And I just wanted to show that it's very hard to evaluate. How do you evaluate what Gandhi did? How can you evaluate what Martin Luther King did? But they just did the right thing because they knew that was the right thing to do. My final slide is just put it together. It's, you'll see challenges, you'll see gaps and opportunities. Put it together and look at the big picture. Sir Michael Marmot, who's from UK, has worked on social justice and health equity for some time, and he says, do we have the knowledge? Of course, yes. And do we have the means? Yes. But do we have the will is my final question to you guys. And thank you again for listening, and I'm here to answer any questions you have. And thank you again, Mustafa, and the IOMC team for having me present this today.
Thank you very much, Nazeera, for giving such a touching presentation and also for sharing your inspirations and experience with us. I must say you did actually reach our hearts today, and you did touch our souls. For that, we are very grateful to you. All right, let me just now open the floor for any questions or comments from our participants. If you have any question, you can raise your hand by clicking on the icon so that we can unmute your microphone. Alternatively, you can type in the question in the comments or question box so that it can be shared with Dr. Nazeera. Dr. Nazeera, if I receive any question or comments, I would also type it in or perhaps just share it on the question box. So perhaps you can have a look there as well in any case. Thanks.
Yes, definitely. And I do see some comments, and so someone has said, if looked at the root cause of most universal problems, it has to do with lack of caring for others, too much self-centeredness. And that's how you need to start instilling health caring. How do you start health caring instead of just being a health care provider? How can you instill the language of health caring to people? And also someone has said we shouldn't judge a book by its cover, which is, yes, I was able to give you examples. So there's a question here. If we look at around us, there are many sad cases when health issues are caused as a result of greediness to make more profit while ignoring the rights of the community. For instance, the irresponsible burning of lands in Southeast Asia, which caused massive air pollution for several neighboring countries, or people who smoke in public transport and endanger others' health, happening in developing world with poor enforced laws against such acts. How could we stop that? Having tight laws to force people to change, or by a rather fundamental change in educating people? To me, both approaches should go hand in hand. That's exactly true. And that's the approach we took here, because what we did, we empowered the community to start working on policies. First, education was done on why smoking was bad, and the education went deep, and to say why secondhand smoke was causing others ill effects to others' health. And then we brought about this community awareness, and they came together as a coalition. They were able to go connect with the politicians and ask for smoke-free laws in parks, in their county buildings, in public areas, in schools. So exactly, you're right. We need to approach both, go hand in hand, policy change and also fundamental educational change in people. I have another comment. They say, thanks for your wonderful presentation. The joy and satisfaction that comes as a result of helping the community and making a change in other people's life is so unique. That's sometimes the biggest happiness that you get, because sometimes you can lose, you can find yourself in serving others. Another person says, I believe that showing humanity, compassion, and empathy are among key qualities for any successful leader or manager. And yes, and like I said, the social intelligence, that's our biggest challenge. How do we bring that back and become a village in raising our children in the future? And I wanted to, Mustafa, I think there are no more questions. I wanted to end really by going to the third slide, what Dalai Lama had to say. When people asked him what surprised him most about humanity, he answered, man, because he sacrifices his health in order to make money, then he sacrifices money to recuperate his health, and then he's so anxious about the future that he does not enjoy the present. The result being that he does not live in the present or the future. He lives as if he's never going to die, and then dies having never really lived.
Thank you very much, Dr. Nazeera, for this wonderful presentation and for sharing all your wonderful experiences and stories with us. With that, I would like to now close this session. Once again, we thank Dr. Nazeera and welcome all of you to hopefully join us again for our upcoming webinars and during the IOMC 2014. Thank you, Dr. Nazeera.
Thank you so much, Mustafa. Thank you all.